I was 18 when I dreamt of being an organizational psychologist. Idealistic in my own way, I thought I was going to change the whole world. Unfortunately, my first job was to get people out of their jobs. And I remember the shock and the horror on people's faces when the announcement was made for them to pack up and leave the organization within the second. I remember Sweet Mary. Because of the recession, even nuns were outplaced from churches as administrators. She was such a sweet person. And still in that moment, she was so outraged by the betrayal that she had experienced, that she was aggressive, she was slightly violent, and definitely reasonably vulgar as well. I also remember till today, Mark, super nice, very strong Mark, who had 3 children and 1 more on the way. When he was outplaced, he didn't tell his wife anything. And for 4 months, every single day until he got his next job, he would wear his work outfit and pretend he still had a job so he wouldn't stress his wife out, being the only or the sole breadwinner. It is such a tragic experience when organizations have to change or when organizations have to transform. The level of stress that people experience is sometimes pretty tense. Every single transformation that I've been in from 2008 till today, whether it was airlines, telco, oil and gas, retail, or tech, every single time it would feel as if people were dying. Of course, the ones who are creating the change were always very excited. We should change, we should transform, we should do this, we should do that. But people often would say, matila, which means die in Malay, or saya, which means die in Mandarin, or just daila, which is Manglish, I guess, for die. And the reason why they would say that organizations were transforming was the only thing that they couldn't do was to really, really help people at that point in time, unfortunately. Every single time, CEOs would ask, Hetal, how do we ensure the well-being of our employees during these challenging times? And unfortunately or fortunately, the same standard answers would be, let's launch well-being initiatives so people can be well. And so that question, are these initiatives that organizations implement to keep employees well, especially during stressful times or prior, an assumption that it would be even more challenging, do these strategies or do these initiatives actually work? 70% of the people that we interviewed in organizations, not the leaders, but the employees said, these well-being initiatives like yoga classes or webinars like on well-being or gym memberships or Friday free lunches didn't really solve these problems that they were going through on a day-to-day basis. And so we set out to find out why are these well-being initiatives not actually working when organizations are investing heavily. And these days, especially the past 3 years since the start of the pandemic till now, 2022, well-being has become one of the top priorities of organizations. And so the question is still, why are they not working? And so one of the major reasons that employees were telling us was that it seems like it's just a fad. That company did it, so we're doing it. That company did that, so we're doing this. Instead of having a real clear and aligned purpose with the business strategy as well. That the reason why we're having well-being is to be able to actually get ourselves in the greatest of mental spaces to be able to outbeat our competition, rather than just making it as an isolated initiative on, say, for example, going for hikes, which is not a bad thing. It really, helps with team spirit, helps with all that. It doesn't really address what happens when you come back to the workplace and you have to deal with all of the stress. The second reason why they told us that it doesn't work is because there are so many measurements, so many different surveys, things like measurements of stress or depression or anxiety, or culture, engagement, experience. There's so many different measures that we didn't even know what were we actually measuring in the workplace. And so they started to ask this question, isn't the Hetal like a ruler? Like if you have BP, for example, high blood pressure, and you go to the doctor, there's like this standardized way of measuring it across the globe and everybody can understand the same language. There were a lot of activities and initiatives, but it didn't seem to have the strength to create a total intervention to push the organization forward. Seemed to be a lot of piecemeal kind of experiences. And lastly, it seemed to be led by a well-being committee or HR committee or the senior leadership committee rather than a community-driven experience. Just like how we've created movements for gender equality or movements to make sure that there's racial equality. These movements don't really work unless they are driven by the entire community. And so our journey began and we asked ourselves a few questions. Number one, what is our big why when we're actually doing this? What is this really, really about? Second of all, what is our measurement for well-being? How do we actually measure it? Who should take responsibility for it? How should we take responsibility for it? And so what? What does this really mean? So what was our big why? When organizations were asked this question, we interviewed about 10, asked them, what was your big reason for well-being? It was kind of fluffy and all over the place. And so we began to introduce to them concepts that were actually out in the world already, but 98% of companies still didn't know that these big goals and visions that world-based organizations had launched. Companies over here didn't know that there were certain standards out there or certain purpose out there as well. So one of this is called the ISO 45003. And the big why as to why are we really doing this? According to ISO 45003, which began to break the myth of the fact that we needed to increase well-being. ISO 45003 said that it is not about increasing well-being, but rather decreasing risk and stress on individuals in the workplace. This is also called psychosocial risk, or rather, how the individual interacts with the environment and the stresses that they experience should be reduced. For example, when workload increases, well-being, yes, we can increase well-being, but maybe we should also decrease workload rather than turning a blind eye to that. So I really appreciated this particular thing, which kind of reminded me of family structures, where we try to go for holidays as a family to become closer. But on a day-to-day basis, if we have a lot of drama, at some point we probably will ask ourselves, what's the point of having great team building kind of holidays when every other day we are also having lots of different drama? The second two reasons why were also introduced by World Health Organization in their Sustainable Development Goals 3 and 8, which is it is everybody's responsibility and right to be well and to also have a decent workplace to live in. Now, I often think about my grandfather and what life was like in his day. And if he were to hear these kind of standards and these kind of investments that companies are making, he probably would laugh, because back in those days, it was all about take on the stress, take it on your chin, stop whining, stop complaining, put in the hard work and you'll see your rewards. The reason why these have become standards is because the level of stress that people have begun to experience has actually begun to affect them psychologically, physically, and to the point where it even affects families or communities when people get outraged or stressed out. This can be very risky. It can cause harm. It can even cause injuries, death, and suicide. So it's no longer a laughing matter and no longer a thing to say, employees, when you come to work, just make sure that you deal with whatever it is and find a way to be well. No, it is also the responsibility of organizations to make sure that we reduce these risks, especially as the world becomes more and more challenging. So our big why was to figure out where does Malaysia rank according to these global standards. And so although we found that we rank a little bit further behind, the good news was that we were beginning to measure and assess ourselves. And whatever gets measured, the good news is that eventually when we pay attention to measurements, we actually begin to figure out how to get this done. So the quote goes, what gets measured gets done. And at least our big why was to be able to make sure that we understood where we were going. What were the core issues that came up when we did these studies? A lot of time people say, meaning of work is important, job satisfaction, trust, and people should have more meaning, purpose, and all of that. But in our study, we found that people actually had meaning. They were clear about what they were doing. They were interested in developing themselves. They were satisfied. They were trustworthy. They were really good citizens of organizations. But what was really impacting them was the pace of work. That everything had to be done yesterday. Everything has to be done now, and everything has to be done faster than our competition. This affects people's ability to actually have a life outside of work. And unfortunately, in this particular data, it also shows that people found it very difficult to actually speak up about these challenges. And as a result, also could feel that there's injustice and maybe disrespect to the contract that they signed on when they first decided to join an organization. And unfortunately, when people experience these kind of issues in organizations, back in those days when we stayed in villages, we probably would sit outside our homes in a circle, talk about our issues. We would heal because we are talking, and we would learn because we are listening, and we would grow as a community. But unfortunately, in terms of well-being, social well-being scores were the lowest in Malaysia. We were not socially contributing. You can see that the score is very low over there, enough, especially during these times in the pandemic. We were not contributing, neither were we integrating from learning and growing with each other. And so, whose fault and responsibility is this? Of course, the individuals would say it's the teams would say it's the leaders would say it's management, and vice versa. And when all else fails, they say, oh, it's none of us, it's the goals that we set for ourselves. Unfortunately, the major way of being able to pull a lever and to create a movement is when everybody else takes a responsibility. And so the way that we designed it was, once we got results in organizations, we began to ask these organizations, shall we start to meet teams and have conversations with your teams and figure out what they can do to create a better workplace for themselves, where they reduce the risks and they also increase their well-being? And so we asked a very simple question. When we got teams together, we asked within the teams, what can your leaders who are present in this team do that is within their control to make life better and to reduce stress? And what can we do as a team without even our leaders getting involved to make our lives better and reduce our stress? And lastly, what is something that I can do that I forgot that I have the power for, to be able to make sure that I control my particular environment, I'm well, and I reduce stress in my life? When we asked these three questions, because it was so focused on reducing risk and increasing well-being and increasing our own control in that process, we started finding that people had so many great solutions. One of the things in psychology that we learn is that even though we increase our demand or stress, the best way to be able to rise to that is to increase our control and support. This is called the DCS model, where increase in demand, but if we gain control back in our life and we increase our support, we can probably take on more and more demands. And so this is exactly what happened. And as a result, majority of the teams, as you can see over here, 8 out of 10 of these teams ended up doing, so in this particular project or experiment that we had, we took 10 teams, we took them through the process. 8 out of 10 teams actually 9 out of 10 teams increased their well-being scores just after 2 days of talking to each other. Unfortunately, it was actually very, very difficult. It was easy to increase well-being, but it was very difficult to reduce risk. So well-being was increased by 7% and risk was only decreased by 2%. Overall well-being scores and reduction of psychosocial scores was 9% in just 1 month, which is phenomenal. All the teams, except for one, were able to increase their well-being, but only 5 out of the 10 teams were able to reduce their risk, which shows how stubborn stress can be in our life. That it is very, very difficult, that only half of us are actually able to slowly eradicate it. 2 teams in particular struggled the most, and their scores actually were worse after having these conversations. So why? Why did 2 of them actually continue to suffer and maybe even more so? What happened was that after the team meeting, when they shared their ideas of improvement to the management rejected these ideas without giving any explanation. And this left them feeling even more demotivated and helpless. It reminds me of this story of the biggest torture that they would give prisoners was to get them to dig a way out to escape the prison. But just as they dug to the point that they could feel that they're almost getting out of it. The wardens would fill it all up with soil again. And so this was the same experience of torture, that here's an opportunity, but when we try, we are not heard and we feel demotivated. So what we did was we continued to get them into a circle, but this time we introduced management into the picture. And when management listened, and when everybody spoke, and there was safety there, management actually apologized for the things that they had probably not been able to share with the teams because of their own constriction, their own confidentiality that they had to maintain. And so they apologized for it, and the teams actually felt empathy for the kind of stress that management would also be facing. And through that, all of them realized that they were human and that all of them experienced challenges. And even though no major breakthroughs could happen, they felt much more united after that. Now imagine a world where Mary and Mark didn't really have to suffer purely because they wanted to earn a living. That is actually a reality today. And that is actually what organizations are striving towards, which is one of the most amazing things that organizations, I feel, are trying to do. That focus on not just sustainability and profits, but that focus on humanity. As a psychologist, I used to be very idealistic. I could save the world. But actually these days, I understand more than ever, it's not about saving the world. It's actually about being practical and having safe conversations where everybody figures out how they would like to make a better world for themselves. Thank you.